My name is Sandra Pierre-Louis. I am a family nurse practitioner currently in Las Vegas, currently working for an HMO company where I am currently seeing chronic disease patients. And I'm about to thank you for listening to me for my presentations, my case presentations. And I'm about to present to you a 76-year-old woman, Caucasians, and her name by the name of Betty Juker. The case description is Becky is 76-year-old woman who was experiencing a lot of moon affect, had like diminished interest in pleasure activities, and then she was excessively worried about her finances, and then she was feeling insecurity with when interacting with others, and also difficulty concentrating on finding out words, the right words to remember. Betty had diminished social activity where she stopped going into interacting, going into the senior citizen center where she used to interact with her age population, with the senior population, her age. See, Betty suffered from hypertension, hyperlipidemia. She also received a stent for coronary artery occlusions. And for that, she was taking hydrochlorothiazine, and then she's also taking amlodipine for her blood pressure, and then also she's taking for her for cholesterol. She's taking atorvastatin. She complained of forgetfulness. She seems depressed. She's very anxious, and then her moon. She has a moon side effect, and then complaining of weight loss, where she lost about 7 pounds in 2 months, and then where she was having a lot of difficulty sleeping. The diagnosis for Betty is a major depressive disorder and a mild neurocognitive disorder for Betty. My rationale for her diagnosis for Betty would be Betty had a depressed moon, and she definitely had a diminished pleasure interacting with others, and then stopped going in attending to the senior center where they have activities, and also playing cards. She just don't want to go there because she's having difficulty whenever she plays cards, and then having a hard time remembering. And she had a significant of weight loss, and 7 pounds within the past 2 months. She was having a difficulty. She's having difficulty of insomnia, and she also had some cognitive decline from her previous level of performance, such as memory and finding the correct words. Her treatment for her major depressive, I would definitely choose SSRI. It's a selective serotonin reuptake inhibitor, Paxil and Celexa, because these has minor side effects and easy to tolerate for 76-year-old geriatric populations. For her forgetfulness, I would also recommend for her to have to take memantine treatment, which also could result in a slight beneficial effect in her memory. Second treatment, non-pharmacology treatment that I would recommend for Betty is for her encouraging her to participate in outpatient therapy, encourage her to go back, start attending back at the senior citizen center for encourage her to interacting in social activity, and then also until her symptom is improved. I will also encourage social support and also family member for Betty. My recommendation, if Betty major depression got severe, worsen, I would recommend mental health services. I would also recommend cognitive behavior therapy, problem solving therapy because of her memory not being able to concentrate, or interpersonal therapy. Second, I would also include a multimodal is a type of actions that seems to be effective against the core and the comorbid symptom of depressions. These could be combinations of medications. These are my all the references where I obtain all the information for the cases, and I do want to thank you for your time of listening. Thank you.